Back now with our special show helping women own their health. And we've gathered some incredible women of all ages who have questions.
Okay, so let's welcome Liz, Maria, Candace, Jean-Marie, Carla, and Sophie.
We're also joined again by our women's experts, Dr. Jessica Shepard and Dr. Lisa Larkin. Good to see both of you.
Good to see you.
Okay, questions top of mind. Something that you brought up was alcohol.
Yes, so
right?
Liv has a question about alcohol.
I do. So I've just been hearing so much information about what drinking does to our overall health, and I was wondering what your advice is for women and when it comes to alcohol use.
Okay, great. I'm going to tell you what you're not going to want to hear, which is alcohol is bad. Really, there's many of us that believe that there's really not a safe level of alcohol. You may have heard that, you can drink red wine for heart health, but actually the impact of alcohol is terrible on lots of things. Sleep, mood, but the big thing women don't recognize, and I'm a breast cancer survivor myself, is that it really impacts breast cancer risk. And so you really, less alcohol is better and none is the best.
Yeah, none is.
How does it impact breast cancer risk?
So we don't know the exact mechanism, but there's clearly a correlation between it probably impacts the way local metabolism of estrogen is within the breast. We don't exactly understand the pathophysiology, but the data's clear.
Yeah, and I feel like when you find yourself turning to it for stress relief, which I think a lot of women in their 30s and 40s and 50s are doing.
Remember at play dates?
Play dates, mommy juice, and that actually isn't, hopefully you don't need something to numb you from your children.
All right.
Is that the same with gummies? Because I hear a lot of young women also saying, well, I'm not drinking, but
I'm doing
gummies. And that's a really interesting thing, which is, we have data about alcohol. We don't have great data about gummies, CBD, THC, but I would tell you, lack of data does not mean that it doesn't have an impact, and it could be negative.
Let's go on to our next question. We have Candace. You're in your 30s, and you've got a question for Dr. Shepard.
Yes, I love that we talked about breast cancer health and just awareness. I know October's a big month regarding that. I'm now in my 30s. I've never gotten a mammogram once. I've never even thought about getting a breast exam, but I do want to know, just who does it? Where do I go? When it's time?
Well, this is a great question. Everyone. I think, at some point I want women to understand that when you're more aware of your breast tissue, that is going to be the best solution for what's going to be able to help diagnose sometimes some cysts, some lumps. So here we have a really good, clear idea. So all breasts are different, right? Different sizes, different textures. So it's always important using your first two fingers to really get some good pressure when you're doing exams. When you're looking under your underarms, you want to make sure if you feel anything like a frozen green pea, that's when you want to go talk to your doctor and see what exactly is this? This is what I felt. And then last but not least, looking at the texture of your skin. If you look like at the peel of an orange, if your skin starts to look like that, that again can be early signs of some inflammatory breast cancers. So again, having the conversations when you go in for your annual.
And the mammogram should start when, do you think?
Mammogram should start at the age of 40, and really we want women to get that every year. We really do know that early detection is key when it comes to breast cancer.
We want to say, first of all, thank you to both of you, and to all of you lovely folks who came out to be with us. A lot of your questions are online.
No, wait, stay right there. We're going to answer more questions right after this.
That's what I missed. right after the break. That's right. We are back with our women's health doctors, internist Lisa Larkin and OBGYN Jessica Shepard. They're answering our viewers' questions. What do you say we get back to it, guys? We had a lot of questions. Where is Maria? Hi, Maria. You've got a question for us.
So I'm in my 50s, and I have 11-year-old twin boys, and I'm exhausted all the time. So I'm wondering if there are any supplements I can take to increase my energy?
Okay, great. Well, I would start by saying no wonder you're fatigued and tired, but I would tell you to start with the answer is not necessarily supplements. So I would really look at what's going on in your life. Are you sleeping well? Are you getting restorative sleep? Are you drinking too much alcohol? Are you exercising? Are you managing your stress? We start with all of that because that impacts energy, right? Sleep.
She's not getting sleep.
You're not. But the other thing is the impact of hormones, right? So I don't know where you are in your kind of menopause transition. I assume you may be postmenopausal, right? All of those things can impact energy level. But the big thing is don't miss other diagnoses. If you're really fatigued, you need to see your primary care doctor. Make sure you're getting all of your preventative health care. You've had labs done. We've screened for other deficiencies and thyroid abnormalities and anemia. So don't neglect those things.
So supplements
don't work?
Don't work?
So supplements are appropriate for very specific things, but in general, the belief that supplements can replace healthy lifestyle and good diet is just
What about
not there.
vitamin-
You're making expensive urine, largely.
Well, there are a whole bunch of things people try.
Yeah.
People are like, they try a cold plunge, they try exercise in the morning.
Vitamin D,
meditation,
Right.
vitamin D.
I think all of those things can be really important as part of overall wellness and stress management, and I don't negate those things. But I don't think you can get energy in a bottle.
But Dr. Larkin, you were advising her to get all her labs done, get blood tests.
Yes, for sure.
So many people don't have a primary doctor. They live in a health desert. There's health disparities. What do they do? They can't afford that.
Right.
That's a great thing for telehealth. I think telehealth has really expanded the ability for resources. And then also finding organizations that go to local churches and community centers to give health care. Excellent resources for people who don't have access.
Do we have time for one more?
I think we do.
Yes.
Okay, we have one more question
Got our
about
question
what's here.
about an IUD.
IUD.
Yes.
Here we go.
Okay.
So I got an IUD when I was 20. Now I'm 27. I really haven't thought about it in a while. I don't really know what's going on down there. Should I get that checked out? How should I go about making
absolutely. So IUDs, just to give you a quick look, this is an IUD. Just the red part is the part that's left to be inserted. So the good part about an IUD is it's long-term contraceptive care, which is why you said I've been 7 years without. So the real question is, when should you check in on it? Every year that you go for your annual and go to your doctor saying, hey, I have an IUD. What is the location? How are you feeling about it? Has it changed anything about your cycle? Those are the key questions. But I think that an IUD is a very appropriate form of contraception, and you're doing the right thing. So kudos to you.
But her doctor hasn't asked her anything about it.
Then that's why I want you to advocate for yourself. And I'm telling you, every year that you go, you're like, what about my breasts? What about my contraception? How is it doing? And those are the questions that you should be challenging us with to answer.
We have more questions, and we don't have enough time. So I think you are coming back for our Instagram Live. Maybe give us the questions we should be asking our doctors every time we go to visit.
And we want to say thank you to you guys for coming in. Y'all had great questions. We really, really appreciate it. Thank you to this awesome Maria Shriver. But we'll be back. There's more to talk about right after this.
I think that's it, is to advocate for.